USMLE style question. Prosthetic device infection by Staphylococcus epidermidis. Question. A 60-year-old man with a history of hypertension, diabetes, and a previous total knee replacement presents to the clinic with persistent fever and localized swelling around the surgical site of his knee. The patient underwent the knee replacement 6 months ago. His symptoms have been gradually worsening over the past 2 weeks, and he now complains of increased pain and difficulty moving the knee. Physical examination reveals erythema, swelling, and warmth over the joint, with a localized sinus tract draining purulent material. Blood cultures and synovial fluid cultures are positive for a coagulase-negative staphylococcus. Which of the following is the most likely cause of this patient's infection? A. Streptococcus pyogenes. B. Staphylococcus epidermidis. C. Pseudomonas aeruginosa. D. Clostridium perfringens. E. Mycobacterium tuberculosis. Answer and explanation. Correct answer. B. Staphylococcus epidermidis. Staphylococcus epidermidis, a coagulase-negative staphylococcus, CoS, is the most common pathogen responsible for prosthetic device infections. This pathogen is part of the normal skin flora and can form biofilms on prosthetic devices, making infections difficult to treat and often leading to chronic infection. S. epidermidis infections often present with localized swelling, erythema, and drainage of purulent material at the site of implantation. These infections typically occur months to years after the surgical implantation of devices, such as joint prostheses, catheters, and heart valves. Why are the other options incorrect? A. Streptococcus pyogenes. Incorrect. Streptococcus pyogenes can cause soft tissue infections and necrotizing fasciitis, but it is not a common cause of prosthetic device infections. It is more likely to cause acute infections rather than chronic infections seen with S. epidermidis. C. Pseudomonas aeruginosa. Incorrect. Pseudomonas aeruginosa can cause prosthetic joint infections, particularly in patients with immunocompromised conditions or those with chronic wounds. However, it is less commonly associated with chronic low-grade infections compared to S. epidermidis. D. Clostridium perfringens. Incorrect. Clostridium perfringens is a gram-positive anaerobic bacterium that typically causes gas gangrene and rapidly progressing soft tissue infections, usually in the context of trauma or necrotizing fasciitis, not chronic prosthetic device infections. E. Mycobacterium tuberculosis. Incorrect. Mycobacterium tuberculosis can cause chronic bone and joint infections, tuberculous osteomyelitis, but is much less likely to cause an infection at a prosthetic device site. The clinical presentation would also be more insidious and involve systemic constitutional symptoms, fever, night sweats, weight loss. Key learning points. Staphylococcus epidermidis is a coagulase-negative staphylococcus that commonly causes prosthetic device infections by forming biofilms, making it difficult to treat with standard antibiotics. The infection can present as chronic, with localized swelling, pain, and purulent drainage at the surgical site, often occurring months to years after implantation. Treatment requires both removal of the infected prosthesis and long-term antibiotic therapy targeting biofilm-associated organisms. Would you